The second thing is the NHS crisis. I, for one, had to wait 3 weeks for a routine checkup to visit my GP last month. 3 weeks. And I didn't think that was acceptable. I pay my taxes. I very rarely go to the doctors. And it took me 3 weeks from making an initial appointment. It took me 40 minutes to get through on the phone, and then 3 weeks to actually get the appointment. So for me, that's largely because the NHS is overloaded, it's underfunded and understaffed. The system's at breaking point. That's not because immigrants are coming in. That's not because asylum seekers are getting the appointments that we need and deserve. That's absolute nonsense. That's a part of the pressure. But the real reason is because the governments for many years now have underfunded, severely underfunded the NHS and have failed to attract the very best talent. People just don't want to be doctors and nurses and physios and all of those things that people once aspired to be, because the pay isn't very good comparable to Europe and the US. And then on top of that, the working conditions aren't great, as well as the incentives. There's no incentives around housing, around healthcare, or anything like that. There needs to be significant investment. There needs to be significant levels of hiring, and there needs to be better packages available for healthcare staff, as well as digitising healthcare precision as well. We need to be significantly smarter in the way that we use tech, and we need to be smarter in the way that we diagnose illnesses whilst also distributing medicine as well. And that's something that we'll look at in the next video.